And first item on the agenda, the apologies.
Councillors Akhtar and Duran.
Thank you. I'd like to welcome Councillor Norman Jorgensen, who's substituting for Councillor Akhtar. Also in the chamber, we have Councillor Michael Firmager, Councillor Jenny Cheng, Councillor Jackie Rance, Councillor Clive Jones, Councillor Barry Patman, Councillor Adrian Mather, and Councillor Tahir Mather. So thank you very much, everyone, for joining us. Minutes of the previous meeting. These are on pages 5 to 10. Does anybody have any corrections to make? Okay, can I see votes in favour of approving the minutes? Oh, sorry, Clive, do you have a point?
Yes, thank you, Alison. I have asked before and I obviously didn't get any support, but I still think it would be better if instead of...
Clive, yeah. I can't hear you very clearly.
Sorry.
Excellent, thank you.
Yeah, I've asked before, but it obviously didn't get any support. I suppose I'm not sure if it was this committee or corporate and community, but so many of these points start with a member questioned whether new dementia home, etc. A member noted, a member commented, and I can't see why it can't say who the councillor was who asked those questions.
Okay, this point has been raised at overviewing scrutiny management.
Has it?
And addressed last year by the chairman, Councillor Pauline Hellier-Simons. And it was felt that, you know, overviewing scrutiny is very much all of us working together on a cross-party, non-political basis. And there was no need to give people any kind of platform by describing, you know, who it was that made the question.
I'm not suggesting that anybody has a platform from it. I think it is just, I think it's more courteous to the member, actually. If we're not going to change it, then I think we could describe any councillors who are executive members as the executive member, rather than, in this case, Councillor Margetts.
Yeah, that's an equally valid point. Is this something you'd want raised at ONS management?
Yes.
At the next meeting?
Yeah, that would be very kind of you. Thank you.
Okay, we will do that. Thank you. Any other comments on the minutes? In that case, would you like to raise your hand to show approval for the minutes? Okay, so that's unanimous. Item 22, declaration of interest. Do we have any declarations? No. Right. Public question time. We've received no public questions. Member question time. We've received no member questions. Right. So we're now moving on to item 25, which is access to NHS dental services in Woking Borough. We've got a report, an update from NHS England on dental services in our borough, and we're welcoming Hugh O'Keefe. Thank you very much for joining us this evening. I hope you can hear us okay.
Yes, I can. Thank you very much. Yes. Yes, so we've sent you a report updating on state of play with dental services in our area. Access remains a challenging issue. Services have been operating at below sort of full capacity for a period of time now, about 18 months, and we're going to hear some more hopefully shortly about what's happening from the 1st of October. This is largely due to the safety issues that are involved in the provision of dental services, which is sort of slows down the rate at which patients can be treated. And so they're still having to prioritise the patients they're seeing at the moment. And essentially the key criteria they're using to see patients is urgency in terms of pain, swelling and bleeding, incomplete care plans, and those who have more frequent recall requirements, which is children, high oral disease risk and impact on wider health. So this is all sort of driven by a national standard operating procedure they're working within, and that's led by the Office of the Chief Dental Officer. I suppose the caveat for that in terms of how they're prioritising is that it's within the available capacity that the dentists have to see those patients. So it may mean that patients face particular challenges on particular days in terms of trying to get in to the service. And I think the other thing to flag is that we're now in a situation where there's been reduced capacity in the NHS for a period of 18 months, and the consequences that's having for people's oral health. So I think it is now being reported that people who are going to the dentist, their oral health is worse than would have been seen previously. Patients need longer treatment plans and more are having to be referred into hospital. So it remains a very difficult situation. Although the capacity has been scaled up, and we're hoping to see that increase further from October. I think for people who've sort of attended an NHS dentist regularly, which is about half the population, this is probably less of a challenge than those who attend irregularly, as we call them. About 30% of the population also goes privately, but about 20% attend irregularly, only really when they have pain. They don't have an ongoing relationship with a dental practice, and that can mean that there are challenges for them in terms of trying to get into a dental practice. Just to remind everybody, no one is registered with a dentist. You just can go wherever you wish. So we have set up sort of schemes to try and support those patients. We've got additional access sessions being commissioned from a number of practices, 13 of those in the Berkshire, Oxfordshire and Buckinghamshire areas, 3 of those in West Berkshire, all of those are in Wokingham. It is a fairly small level of provision in that respect, but it's a sort of voluntary scheme for the practices to take part, and we're always looking for more who might be able to do that. There's advice for patients about how to get into the system through NHS 111 and nhs.uk. In terms of other things that we're doing, there's been a recent decision to invest significantly into referral services. This is particularly sort of non-hospital specialist dental services based in the community. So things like special care and paediatric, also known as community dental services, and out of hospital oral surgery, to try and help with those waiting list backlogs that those services have as well. There is good news on the hospital situation in terms of the number of long waiters. There's been a sort of 3-month reduction now in the numbers waiting more than 18 and 52 weeks, but we're now just heading into winter, and so we think that's likely to remain a challenge going forwards, as per the rest of the NHS really. We're also, we're also running a pilot scheme to support access for looked after children in terms of making sure they can get to see a dentist. So there's a number of things we're sort of running to try and support patients in terms of accessing dental care, but the significant challenges remain. There is a backlog in the system, and it's going to be with us for some time. But the intention is that these schemes, over a period of about the next 12 to 18 months, make significant inroads into them. Thank you.
Okay, thank you very much for that review, Hugh. Obviously, there's some good news in there. There's some things of concern. I noticed of the 13 practices in Bob, it looks like 3 of them are in our borough, which is good news for us. Yes. I had hoped that you might be able to tell us some data, some figures specifically for Woking Borough. Is that not possible?
I haven't got them on me. What sort of, and we can send you some afterwards if you like. What sort of figures would you be looking for?
Yeah, just to understand how we related. I know you said normally attend the dentist on a regular basis. I think if we could see what that figure was in Woking and Borough, it would give us more insight into whether there is a significant problem here. I think all of the members do hear from residents who found it very difficult to find a dentist.
Yeah, we can send you. We've got that data. We've got sort of the most recent information is suggesting that the numbers attending are sort of below that figure, really, because of the situation with the pandemic. But we have got the sort of access figures broken down by local authority, so we can send you that.
Yeah, and you also have data, I presume, on how many dentists per head there are in each borough?
We have dental practices rather than dentists, so we don't have the information on how many dentists and what sort of whole-time equivalent there are. They're sort of independent contractors, so our relationship is with the practices rather than with the individual dentists.
Oh, yes. Right, I know members have got questions. If I was just going to ask about the Royal Berkshire Hospital, and obviously it's very pleasing that the number of patients waiting has fallen. Is there an explanation for that? You know, how did they achieve that success?
And the Royal Berks is in quite a good position in that respect in terms of the oral surgery. Essentially, they've been focusing sort of the resource around the long waiters. So there's been a sort of the integrated care systems are leading a restoration and reset program, and they're looking at that PAN system, and so each of the specialties in the hospital is sort of part of that program, and the OMFS department at the Royal Berks has been sort of running additional sessions, weekend sessions, and I think the advantage they probably got compared to, say, the hospital in Oxford, which has got a sort of bigger backlog, is they don't admit as many patients, so they can push more patients through as day case and outpatients. So they've got that flexibility there to do that. So, but they've definitely made good inroads into it, and it's again, I can send you those numbers because it's quite small numbers now, over 52 weeks.
Great, thank you. Tahir.
Hello, thank you for your report, and it is actually quite an informative and good report, and thank you for that. I appreciate that. One of the questions I had was, again, following up from a feel of the service the residents of Woking can expect, etc. So if you think about it as before COVID, NHS contracts with the dentists, etc., was a 100%. Yes. Comparative to that, what is the what is the proposed service level percentage for the norm as it is at the moment? So how much, if it was prior to COVID is 100%, what would it be now? I know that in your report, or in the report, it says a number of times there is a contract with the dentist services to provide an equivalent amount of NHS and all the rest of that. But how much of that coverage is it compared to what it was before?
It's 60%. So that's designed as a sort of minimum threshold. The dentists are sort of paid on the basis of the activity they deliver. So they get paid a 1/12 amount on an assumed level of activity each year, and they have to get over a certain percentage to retain that money at the end of the financial year. Otherwise, we do financial recovery. So the 60% is acting as a minimum threshold. So they can deliver more than that. I think one of the things they're flagging with us at the moment is the high demand for urgent care means that there's relatively low proportion of their work is routine. Probably most of us will go for our regular checkups to the dentist, and that would be a sort of fairly quick procedure for them. What they're finding is a much heavier caseload now in terms of the needs of those patients, and therefore it's taking them longer to treat. So that target actually is quite challenging for them in terms of trying to get to that 60%. And I think probably people are aware generally this is an issue with NHS services. The rate, because of the pandemic and all the safety things that have to be followed, the rate at which patients can be treated is slower than it has been. And as I said, we're hopeful that we will see some sort of increase in that from this Friday. So this is all defined nationally in terms of how this works. But there's still, within that, there's a big backlog the dentists need to catch up with. And one of the things, you know, we are acutely aware of, and we're getting a lot of communication on how difficult it is to access even urgent care at the moment. Behind that, the dentists have got a big backlog of people just waiting to come in for routine appointments. You know, people in the room might be in a situation where they think they've got an appointment booked in and their dental practice has been cancelling because they've got to bring in more urgent patients.
Thank you.
Adrian.
Sorry, thank you, Chair. It's really good to see you, Hugh. We've been asking to talk to the dentist for a very long time. We've had a significant number of residents and really struggling to get access to dental services. Also, Health Watch in Wokingham has been highlighting dentistry as a specific problem area, I would say, with some really quite distressing anecdotal evidence. So whilst it's really pleasing to see you, and I can start to appreciate the storyline, and you've described the storyline in your report and highlighted a few areas, and we understand obviously the impacts of COVID, etc. What I would really like to see is the financial numbers and KPIs that, you know, is driving your organisation. You know, what concerns me is, you know, how much money is being spent on NHS dental care in Woking Borough compared to other boroughs. How much is going to not necessarily individual practices, but whatever unit of measurement you use to allocate those contracts, etc. But also some patient ratios, because I would want to see significant investment in dental services in the Woking Borough. That's what our residents are requesting and challenging us on. Thank you.
Okay, I mean, we do have that sort of information in terms of the spend on the practices, and just the practices are paid on a thing called a unit of dental activity. So that just sort of gives an idea of the sort of volume of activity that's commissioned each year. That does act as a sort of cap, if you like, in terms of what they're supposed to deliver. So we've definitely got that information, if you find that helpful. It's worth saying that you know, the situation with dentistry generally is under ongoing review in terms of the impact of things like housing growth, and we are aware Wokingham is undergoing significant growth at the moment. I think, in all honesty, that at the minute has taken a bit of a backseat. We are looking at that now in terms of trying to get into the medium term, and we're starting to get closer now to the integrated care systems in terms of how this is all going to work. But at the minute, the focus really has been about investment into things like the additional access sessions, in terms of trying to just get more capacity from the practices, investment in the long waiters on the referral pathways. So it's really at the minute about just trying to invest as best we can in terms of trying to facilitate as much access as possible.
Adrian, do you want to ask any more on that?
Yeah, I mean, one thing that I'm always really interested in is, okay, what's the historical numbers, but what's your budget going to be when you have ICS Bob, et cetera, et cetera. So again, comparatives would be really helpful. You know, for instance, you know, in Bob, you get an average per patient. You know, what is the average for Woking compared to Bob, and all these KPIs I would really like to see, because frankly, I think, you know, there's been underinvestment for many, many years in NHS dentistry, and I want to see that turned around. Obviously, we all know, everybody on this call knows, that if children's teeth are not taken care of, that ends up as much bigger issues, and adult teeth can end in A&E and all sorts of other medical complications. So I regard dentistry as a really fundamental thing that we've dropped the ball on for the last 20, 30 years. So I would like to see yourself within the ICS framework really, you know, challenging the amount of money that's available, and coming back to report to us to say, you know, we've secured some more money.
Okay. I mean, we're just, ICS is going live now, isn't it? The 1st of April 22. It does look as though it's still early in terms of the deliberations about it, and they're submitting their plans in the next few weeks in terms of going forward. But it does look like dental's going to be part of their sort of responsibility from then. So we are now working at you know, what the allocations will be, and it's worth saying that the allocation that goes to general dental practice each year is a sort of fairly fixed figure. So they deliver a certain amount of activity. It's a sort of contract planned activity and a planned amount of funding. And as long as the practices continue to deliver to that level, they retain that level of funding. And I think this area has seen some investment in the last sort of decade or so. The Dental Access Programme of about 2009 to 11 did see a new practice open up in Finch Hampstead. There's a new one opened up in Early as well. It's called them new, they've been there about 10 years now. But so there has been some expansion of dental provision over that period of time. But, you know, as you're sort of describing, the pressures continue, the houses are continuing to built around Woking, and it's fair to say that you know, dental services in effect have to compete for resources alongside many other health priorities. So, you know, that's always a factor we have to take into account.
Okay, thank you for that, Hugh. Nick Durman from Health Watch has a question for you.
Yeah, thanks for that, Hugh. And that's pretty much as I understood it. A couple of things, because I like to deal in the real stories of local residents, and I could read out 20, but I'll read out the one that I received today, saying I've tried about 10 dentists for my daughter, but is unable to find one that is accepting new NHS patients. A filling came out, she needs to see someone. It looks like it's infected. I don't know what to do. And so amongst the other, and I understand the pressures and all of that and the fallow time, and the dentists are really under pressure. But I guess the one thing for me is, it's like one parent said to me, if I can't register, then I'm not in the queue. And if I'm not in the queue, how will I ever get treatment? So it'd be good to get a comment on that, about whether you're entitled to register. And if it's not a right to register, then what are your rights? So I can inform local people in Woking Borough what their rights are, because I think there's a bit of confusion around that. And the other one was around the commissioning moving to the ICS. And I read something today, and it might not be correct, but my understanding was that it's likely to be deferred until 2023. So on the first point,
what should be happening in all cases, and this again is all laid down in the standard operating procedure that the practices follow, is that if a patient phones an NHS practice, they're supposed to do a AAA assessment on them, which is advised anaesthesia or antimicrobials if necessary. So what they should be doing is, even if they don't have the capacity to see the patient, they should be able to do something to tide them over. And they should also then be assessing the degree of urgency for that patient to be seen. So registration is not supposed to apply here. So if there are specific cases like that, we will follow up with the practice to see what they've done, what records they've got on how they've dealt with that appointment. But I have to say, this is not the first time we're hearing this, and I think one of the things we want to see from the arrangements from later in the week is to what extent there might be something in the national guidance that might help with that. The other thing to try to do is, I think you've got the list of the additional access providers there. So if the person's not been going to the dentist regularly, has got dental pain, there are those practices open extended hours may be able to take them on. But I think this is where this issue about practices providing these services within their available capacity is the issue, and the practices may well be feeling they don't have the capacity to do that at the moment. But we happily look into any cases that come up, and we will follow up with the practices concerned to see that they've done what they should have been doing. The ICSs, I think that in terms of that timeline, what I've said to you is the sort of proposal. The drop dead date is April 23. The expectation is that it's definitely done by then. Some areas are going to be sort of early adopters, and the services will be integrated from April 22, and that's the submission that's going forward for the whole South East at the moment, and it's due to land nationally, I think, in the next 2-3 weeks. And then there'll be decisions made about whether we go ahead in 22 or 23.
Thank you. Councillor Barry.
Just a quick follow-up, if I could. So we have had the communication around the additional appointments available at those dental practices that have them, and we communicate that to everyone who phones Health Watch help desk with an issue. What we haven't really seen, it's always about communication, is a communication to the patients about what they should do if this doesn't happen, and that would be really useful.
Yeah, okay.
So if you could provide something like that, it would be really useful for the help desk to be able to give that to the people who phone up and say, I've tried this, I've tried this, I've tried this, what can I do now?
Okay, yeah, okay.
Okay, thank you, Nick. May I remind those joining us on Teams to put their cameras on? This will enable the public watching on YouTube to know who is speaking. Thanks, Nick. Right, may I move to the next question?
Is that me?
Are you happy, Nick? I know Barry Patman's got a question to ask you. Barry, would like to ask your question.
Yeah, sure. Yes, I've had some concerns from various people that have contacted 111 to get information about where they can get dental help, so forth, and they've been given information, and then that information, when they've actually contacted the places concerned, didn't match up to what they expected and were hoping for. And I wondered what the relationship was between your setup and the 111 service as to how regularly the information is updated.
What 111 are doing is identifying patients of the 3 nearest dental practices to their home address. So they're using the NHS.uk site for that. That's a system that should be updated by the individual practices. It's a bit mixed as to whether that's happening. So we are aware that there is an issue about patients trying to make contact through NHS 111 and whether or not that's being successful. So that is something we're continuing to monitor. We do have sort of regular links with NHS 111. We're also trying to do some work directly in terms of the NHS.UK website to try and make sure it's up to date, because some of the practices on there, when you do this nearest practice search, it's picking up referral services like orthodontics or community dental services, and we're trying to get NHS.UK to sort of take those off so that people are just being guided towards dental practices.
Okay, thank you.
Adrian, I can see you've got your hand up.
Thank you, Chair. One thing that I'm particularly interested in is resilience.
Adrian, we do have other members waiting to ask questions. Is this related to your previous question?
No. My question really is, on the assumption that these dental practices can stop trading, stop doing business, etc., etc. Do you have a resilience plan? What does it look like, and can we see it?
Well, I think that's where we've looked to bring in these additional access sessions to provide this sort of system backup. The practices are all providing services. There's no one has shut in this period in terms of ceasing NHS provision. We are aware certain areas it is more fragile and there are practices handing back their contracts. So we should sort of note here that I think a lot of the dental practices have been going through this now for 18 months. There's heavy duty sort of protective equipment they've got to wear. They are now beginning, some of them, to have challenges around retention of staff. So we're trying to sort of work with them on it and then get some backup in the system to them. The issue we've got with the additional access sessions is it's a voluntary system. So the practices are independent contractors. We make resource available for them to take part in it, and then we're a bit dependent on whether they're going to come forward. But what we're trying to do is repeatedly go out and see if people will support us.
Okay. Thank you, Hugh. I'd like to go to Councillor Michael Firmager now.
Oh, thank you, Chairman. Thank you, Hugh. Very interesting, informative presentation so far. I've just got really one question, actually, and it's where you refer to page 13 of our document, anyhow, where practice may have to temporarily close if members of the dental team or their household are required to self-isolate. I'm just really kind of wondering, obviously that's going to cause use disruption and add to the waiting list even more, which has been referred to earlier on. But I'm just kind of wondering what sort of uptake on the vaccinations are there?
In the dental practices? Is that
well, yeah, in the dental practices, i.e. to stop them shutting so the patients can get the treatments and service that they rightly deserve, really.
I mean, I think the good news is we've not had a practice that's had to shut. Certainly in the last, I think maybe a year ago, maybe there were one or two, but in the last few months, that's not been an issue. Paul, my understanding is that there's high uptake of the vaccine in dental practices, double jabbed. I mean, they have to have certain vaccinations anyway to provide dental services. So I think there's awareness of the need around that. And I think it also reflects the fact that we feel they're in potentially quite a vulnerable position in terms of what they're doing, in terms of the treatments they're providing. So we don't sort of hold information of that sort. And again, just to be clear, we don't employ the dentists. The practices employ them, and they'll have the records about things like that.
Okay, I just wondered. I mean, obviously referring to other injections, vaccinations, i.e. hepatitis is one that does spring to mind. I know surgeons have to do that as well. But I just kind of wonder if it's in the records of the dentist practices themselves, what kind of oversight is there? Because they're doing it in the name of the National Health Service. That does sort of concern me somewhat. If there's no control and they can do kind of really what they want, I don't think that's the right thing to do, to be perfectly honest.
Well, they have contracts with the NHS that define the services they have to provide. All the dentists who work within the practices are on a national performer list, which is the way in which their clinical practice is supervised. So any issues of concern are taken through that route, and we have sort of clinical advice and support with that. There's also the General Dental Council in terms of their standing as a professional, which can deal with issues, and all practices are registered with the Care Quality Commission. So there's quite a lot of checks in the system in terms of what they're doing.
Okay, well, at least that's good to know. I mean, I do appreciate that the dentists, for some reason, and I don't really understand the reason why, it's nothing to do with, I think it's to do with further up the level, we're treated differently to doctors. And I can't really see the sense in that, but we are where we are with it. So hopefully no dentists are going to shut. There'll be a full service, and hopefully all backlogs will be cleared and people can see the dentist that they so require. But that's a perfect world. So that's what we all hope for.
That would be great.
Okay,
it's worth saying the supervisory arrangements around dentists and doctors are essentially the same.
Thank you.
Okay, thank you, Hugh. I'm going to take the last question now from Councillor Clive Jones.
Thank you, Alison. Thanks for the report, Hugh. For all of my life, I've been told that I should go to the dentist for a checkup every 6 months. And in your report, it says that 52% of our population are going within 2 years. So that probably suggests that the health of our teeth and our gums and things are just going to get worse. In Wokingham, in the next 20 years, we're going to have an extra 30,000 residents. Can you tell us what NHS England and NHS Improvement are going to do to find us the extra dentists that we need so that we can have checkups every 6 months, and the extra dentists that we need for these extra 30,000 people that are going to come here to live?
Yeah, I think in normal circumstances, I agree with what you're saying. Dentists work within guidance called Delivering Better Oral Health, and that's about the recall intervals. So for some of us sort of older folks, we're known as the heavy metal generation. We should go regularly, and we should go every 6 months. Personally, I'm on a 6 months recall arrangement, and actually did go to the dentist in about May. And that is the normal situation for people. It should be related to the state of your oral health, and it tends to be the older you are, the more you need to go. There's also an issue about fluoride toothpaste. So it's people who kind of born post 1960s really have always had fluoride in their toothpaste, and they tend to, which is a very broad statement, but tend to have better oral health than those of us who are a bit older than them because of that benefit they've had from early life. So, but at the minute, all bets are off with that sort of thing, and I know, for instance, my kids have recently had routine appointments cancelled because clearly the practice have got other priorities in terms of who they're seeing. We are looking in terms of the medium term, in terms of this impact of housing growth on the requirement for dental services. I think this is something that we'll be working alongside the ICSs with in terms of getting that established, looking at across more broadly at primary care as well. So that is something that's on our radar, looking into the medium term once we feel we can get over the hump of this period.
Thanks very much. Do you think you might be able to come back in a year's time and give us an idea of a plan for the number of dentists or surgeries, or number of individual dentists would be better, but we might look forward to having over the next 20 years? Is that possible?
Yeah.
Great. Thank you very much. I've got another question. On page 14, it says, in some instances, practices may have filled their NHS appointments, but still have private appointments available. And this is why sometimes patients may only be offered a private appointment. Is there any chance that the dentist can convert their spare private appointments to NHS appointments?
We are sort of discussing that in terms of whether that is a way to take things forward in the short term. The dental practices are sort of, even the ones that are fully NHS normally have quite a big private commitment. It's quite a sort of mixed economy in terms of those practices, and they often will set aside surgeries physically within the building that will be for private and for NHS. But that is something we are looking at, whether that's something we could do in a way that's seen to be sort of financially robust, in that they are already in receipt of income from us. So we have got to work out that issue, but that's something that's being raised with us. We are looking at, because, you know, as I'm saying, this is going to be with us for a little while, this issue.
Okay, so maybe you could give us an update on that in 6 months or a year's time.
Yeah, certainly. Yeah.
Okay. Thank you, Alison.
Thank you very much for attending, Hugh. And as Clive said, we would greatly welcome your return to see us in a year, so that we can see the situation post-pandemic. And we do hope that our residents will be finding it easier to access a dentist in time of need.
I hope so. Yeah.
Thank you very much.
Thank you very much.
Hope you can enjoy the rest of your evening.
Thank you very much.
Thank you.
Sure. Bye-bye.
Okay, members, next item on the agenda is 26, an update on the performance of Optalis. And we're welcoming David Birch, who's with us this evening. We also have Matt Pope, the director, and Charles Magetz, the lead member, on the call. So thank you very much, David. You've given us a presentation. Do you want to take us through that, or would you like to just move straight to questions?
Oh, good evening, Chair, and thank you. With your permission, I'd like to run through the presentation, draw out some salient points, and then take questions after that, if that works for you.
Yeah, if you just add some points, because members have all had time to read and digest it. Thank you.
Of course. So I'll just open up the file. So while that loads, just to introduce myself, so I'm the chair, the chief executive of Optalis. I've been in post now for 18 months or so. My background is not adult social care. I came from a world of professional services, and I was brought in specifically by the council to start the transformation process for the Wokingham owned company that Optalis is. So what I'd like to do is just run through some pointers on how Optalis has performed through the pandemic, and then point to you on how Optalis is actually developing and moving forward to provide an even better service to local residents. So I think the first slide is just setting out the range of services we provide. I think lots of people think of care homes. They don't think of all the other services that are provided by care workers, and that just lists a number of them. And I'll draw out some themes around the importance of some of those different services as we go. But in terms of operational performance, I think it's been a very difficult time, obviously, as we were hearing from the previous speaker. in a Care Quality Commission regulated environment, maintaining standards through the pandemic has been a big challenge. And I have to say that the way that Optalis and our staff has performed through that, I think has been exemplary. We had our first post-pandemic CQC inspection of our reablement team, we call START, a few weeks back, and we got a very good uniform, consistent vote of approval from CQC in terms of how that service is performing. And as the first one post-pandemic, we were all quite anxious about, how we were, had we maintained standards to their very, very exacting levels, and we had. In terms of the finances, I have to pay tribute to Matt Pope here. Matt has been very clear indeed around what he expects Optalis as your adult social care company to deliver back to Wokingham Borough. And we're now, as it says there, halfway through a 2-year saving programme. We've delivered the best part of £1 million back to the council, and as you'll see from slightly further on in the presentation, we're also contributing financially in other ways, as well as enhancing the care that we provide to residents. We're beginning the process of growing our services within Wokingham. I've mentioned the Gorick Square service there, and that's just the beginning of what we hope will be a significant tranche of new services that we're moving to Optalis over the next few years. But the last bullet point on that slide is something I really want to draw out. Supported employment is where we help people who might otherwise be excluded from the employment market, people with learning disabilities and autism, people who would not normally find it easy to find employment and to engage in economic activity. We help them by training them, to give them skills, to give them confidence, to give them the wherewithal to go out and get jobs with our support, and then deliver those jobs in a way that gives them dignity, it allows them respect, and it allows them to feel they're part of the community and making a real contribution. And in many ways, this is one of the jewels in our crown. It's a service which is #1 in the southeast of England for the last few years, and #3 nationally. And our aspiration is to get us Wokingham's service to be the best in the country. But it really does make an enormous difference to residents who would otherwise, as I say, be excluded from being part of the normal community lives and economic activity. And I receive letters from customers who've gone through that process, and some of them absolutely make you want to cry, because the difference that those services make to people is transformational for their lives. Moving on, the pandemic has obviously been an enormous factor in everything. We're really proud of that first point about the fact that not a single customer or a member of staff has died as a result of a COVID infection picked up in our services. And that's really a tribute to everyone who works within Optalis at all levels, the way which everyone has maintained the infection control procedures, the way that we have had a solid PPE supply chain throughout, the way that, as you're going to see shortly from other slides, people have been so flexible in what they do. I mean, people talk about the importance of diversity in a workforce, and diversity can mean almost anything. To us, over the last 18 months, it is the way that our people have revealed unknown skills, unknown talents, the ability to do things differently, and to do it with real enthusiasm at a time when actually some of these people are in the front line of care. They're going into people's homes not knowing what they'll find, what level of infection they will be. So I think I really want to pay tribute to everyone who is on the staff of Optalis for what they have achieved and in keeping everyone safe. We're also really proud of the second point, helping out the council in terms of the surge testing, volunteers who joined in, and Matt rang me up from the Bullmarsh Leisure Centre while the surge testing was going on and saying, David, the Bullmarsh Leisure Centre is being converted into a vaccination centre for young people. We're going to have to move out. Can we come down to your offices in Trinity Court in Mollymillers Lane and actually run the second half of the surge testing from there? And of course we did. We cleared the decks, invited the team in, and we're really pleased to be able to help WBC so directly at that important time for local residents. Touching on supporting minorities, it's been such a difficult time for people in all sorts of different groups, and not necessarily, again, the groups you would automatically think of. If you think about people's life expectancy, one group that has perhaps one of the most challenged life expectancies of all is people with Down syndrome, and keeping people with Down syndrome safe through all of what's been going on, as well as all the other different communities and different groups of people who've needed support, has been really high on our agenda. And the last point, we do recognise that we've had to severely restrict the day service activities we've done. I hope not too many members have had complaints from their residents about that. We've done everything we can in conjunction with the council to keep those services open, but it's been tricky. So what have we learned from all of that? Well, I've mentioned the versatility of our staff and their willingness to cope in a really, really uncertain environment. But it's really made us focus on the importance as an organisation of doing things differently. The feedback we've had from users of our service across Wokingham and across the borough around how we can do things differently for them in future, and we'll come on to that shortly. And the final point there, I mean, you know, the way we're working now as an organisation, this is our 10th anniversary week of the creation of Optilis, and I think the relationship we have with the council, with Matt's team, and with Graham's team is probably the best it's been in terms of alignment. There's complete alignment in terms of everything we need to do, and the pandemic has really helped us focus down on why we're here, and that is simply to serve Wokingham residents and to make sure we're generating value for money for Wokingham taxpayers. So moving on, we really want to learn those lessons and begin to transform Optilis in line with the council's strategy. So I mentioned before that Gorick Square was the first of the new services that we're looking to take on. There's around 10 to a dozen of other services we're talking to Matt's team about, which Optilis could take on. Some are new and some are existing services. And what's really a pleasure for me is the way that the council has been prepared to invest in us, to give us the wherewithal to transition these new services in seamlessly for the people we're here to serve, through the creation of this new peripatetic team. And that's something rather special, because it means that we will now be able to provide seamless services across the whole of our operations in an entirely new way. I love this slide. I mentioned our supported employment service. This is a new bolt-on service for supported employment. It's not just about helping people who would otherwise be excluded from wider community engagement and economic activity. It's about helping them gain the skills so that they can travel safely and with confidence on public transport, which is something that some people obviously view with considerable trepidation, going out on their own into the community on trains and buses. And this is a new training programme which we've launched. It's supported with the partnerships with South Western Railway and Network Rail, and there should be branding on Wokingham Station and Windsor and Eton Riverside Station shortly about this. And also Reading buses, hence the picture there of a couple of buses in Reading, the Emerald service to Whitley Wood. Very supportive of everything we're trying to do here. And this isn't just helping local residents who need these skills, it's actually giving something more back to the council. So you'll see that final point there. In the past, the council has provided taxis and minibuses and so on in a very supportive way to get people around. But because we're training them to have that independence, we're training them to be able to go out and about safely with confidence, that's actually producing savings for the council as well as an added benefit. So very pleased about that. Reablement is something which is going to be more and more and more important in the future. And I mentioned that our Start Reablement team has just had a very good CQC inspection. If you think about traditional care, it's been quite paternalistic, and it involves packages of care where people go into the system and get looked after well. But the modern way of doing this is to try to help people to remain in their own homes safely and independently for as long as possible so they can live truly fulfilled lives. And the reablement service, which allows people to do that, is going to become ever more important over the next few years. So we're going to see continuing growth in reablement and a focus on how that service can continue to give better benefits to local residents. Out and About is one of those services that the pandemic has really highlighted to us. For the 2 or 3 years before the pandemic, we've been running a really successful Out and About service out of the Acorn Centre in Roos Hill. What Out and About does is it's an add-on to traditional day service provision. It allows people out of hours to go out and go to the cinema, go to the theatre, go out to all sorts of events that they might not otherwise get to. And the popularity of that has been growing and growing. And as we found day services have been restricted during the pandemic, we found that there is even more demand than before to expand that service. So we will be looking into doing that. We're looking to recruit a couple of extra people so we can begin that growth process. We produce a booklet every few months, setting out the program of events. We even have a premium service where people who want to get early access to those events can subscribe, and families love that. It's a service that is enormously popular, and therefore we want to build on that popularity. And the last slide is simply to say that we want to do everything we can to turn Optalis into a really, really modern service for residents. So we're working alongside WBC's commercial advisors to see ways in which we can create new services that benefit residents and also generate income for the council. And we're looking to see whether we can set up an Optalis community interest company so we can work more closely with the local voluntary and charitable sector and get access to funding for local residents. So that really is what I wanted to draw out there. I'll be delighted, Chair, to take any questions that the members may have.
Thank you, David, for that presentation. I can see a lot of hands going up. Optalis is certainly a very, very important service for our most vulnerable residents. So thank you very much for everything you're doing, the team that you're leading. I just wanted to kick off by asking you, what's the most difficult challenge you're currently facing? Are you confident you can surmount it?
Oh, that's a very good question, Chair. The most difficult challenge is resourcing, it's staffing. It takes a special kind of person to come in and work in care. It's not just anyone you can just pick up off the streets, because you have to have people who are compassionate and kind, who are prepared to provide personal care to people. And in the current climate, when I drive past Aldi in Wokingham and I see they're advertising £9.55 an hour for shelf stackers and so on, and I think, we're competing against this enormous demand for people across the whole of the economy. If we look at the expansion plans I mentioned, we're probably going to need to nearly double the number of people in our workforce. We have 700 people at the moment. So we'll be looking at 1,200, 1,400 people in a few years' time to serve everyone. And making sure that we can recruit enough of the right people and retain enough of the right people. That's my biggest challenge. Do we think we can do it? We're going to do our level best. Matt has kindly provided some investment for us for a specific resourcing manager. She is doing a fabulous job for us already in terms of trawling the market and finding people who are interested in working in care. But we're going to be going into schools, we're going to be going into the job centres, we're going to be doing everything we can to make sure people realise just how fulfilling it can be to work in adult social care.
Well, good luck.
Thank you.
Michael.
Crikey, first one. Okay, yeah, thanks, David. A very, very informative presentation, and obviously your enthusiasm feeds through very, very strongly. I've got one comment and I've got one question. Comment is actually was on page 24 of our agenda under the heading Ability Travel. I just really wondering, I don't know why, but why is there a picture of Reading Marketplace on there? But really it should be, yeah. I mean, I recognise it because it's St Lawrence's Church at the top, which kind of gives it away. I will walk down there many, many a time.
Yes.
I just really wonder why it's Reading and why can't it be Wokingham Borough, please?
That's a very good question. I'm Reading born and bred. That's not the reason, though. The reason our linkage with Reading buses, and specifically the fact that we are now in partnership with them. If we could have snapped one of those little orange buses belonging to Reading going around the Wokingham streets, we would have done so. But your point is well made, and I take it.
Yeah, there's a plenty that go around. You got little oranges and that go around around Woodley. Yeah. My question is, how have you managed to deliver these savings without compromising the quality of the service?
Yeah, and again, I mean, that's been a challenge for us. I suppose because I used to own my own business, you get very You get very acute about making sure that you're not wasting any money, but the margin really matters to you that you're making. And so it's been a question of going through with a fine tooth comb each level of expenditure. So I did that myself. I'm a chartered accountant, and I remember going through the profit and loss account and identifying areas where I thought we could reduce costs without compromising care at all. So that, for example, we've taken a 5-figure sum out of our insurance premium. We've merged some jobs in our central management team. We've stopped using a consultant to do stuff. And cumulatively, that has allowed us to reduce our overheads without compromising the care that we provide. There have also been areas with some of our services where we've looked at what we've been doing and what the housing provider should have been doing. And the desire of our people to help is such that we've started taking on tasks that the housing provider should have been doing. So we've been rebalancing that. So from a resident's point of view, a customer point of view, I like to think there has been absolutely no change in the quality of service, but in terms of the cost base that we're operating to, it's gone down. And I think that, I agree with Matt, this would be a 2-year programme. We can't go on cutting into muscle. We're now going to get really innovative about how we start to drive up standards of care within the cost envelope we have.
Yeah, thank you for that. I think you kind of covered it a little bit before when you said about the right staff, compassionate staff. If you get the right staff, the people that want to do it, and probably got the patience of a saint, I would think sometimes they need that. I'm not sure if I've got that, but I think you definitely need that. If you get those sort of people, then yeah, you can probably move mountains or something like that. So I just wonder if you might perhaps have another view on that or anything you can add.
I think it is quite extraordinary for me, having come in when I went around some of the operations we have, some of the services we run. We have people who have been looking after the same customers for more than 20 years. Started long before Optilis existed, and as far as they're concerned, it is about looking after the customers, and that is it. And they're almost like members of their own family now in terms of what they do. It's an extraordinary level of commitment, and we're very lucky to have people like that.
Thank you very much.
Oh, sorry, I'm going to go to Clive. And then I think I saw Tahir and Adrian had their hands up, and Jackie. So I'll do you in that order, okay? Clive. Yeah, I got you, Jackie. Oh, Jenny. Sorry. I've just got the wrong J. Sorry, I do apologise.
Thank you, Alison. Thank you very much for your presentation, David. How long have you been at Optilis?
So I joined at the beginning of March last year.
So about 18 months?
Yes.
Well, you've done a really good job in that 18 months. And I think everybody should congratulate you. If you found nearly £1 million worth of savings, then that is extremely good. And I'm pleased to hear that you've reduced the insurance cost.
Yes.
That's something I used to do a lot in businesses. I thought that was always a pretty easy win. But what you haven't talked about is the relationship with the Royal Borough of Windsor and Maidenhead. And I think you've been very instrumental in calming that down and getting a good deal for Wokingham. Would I be right in saying that?
Well, I'll defer to Matt in a minute on that, if I may. But I mean, my own view before Matt comes in is just to say that I think building trust on all sides has been enormously important, and my role in that has been about creating complete transparency for Wokingham Council, so that there is nothing hidden financially or operationally, and therefore that there's no hidden agenda. What you see is what you get. But Matt, I mean, you're in the forefront of all this. Would you like to join in with that?
Yes, I can. I think it's no secret. Over the last 18 months, we've had some sorting out to do, and some of that sorting out has been working with RBWM to work out who pays for what and how kind of fair that is for everyone. We've been through that. We've done that, and David has, as Clive said, helped make sure there's transparency and those relationships have calmed down, and we're in a really good organised position. And lots of the kind of achievements and successes that were set out tonight are all part of that. And I'm very comfortable with the position we're in, with Octopus at the moment. I'm really, delighted with the performance. So we're in a much better space now.
Good. Thank you.
Alison, may I add something to that briefly? It's Charles here.
Yes, please do.
Yeah, I was just going to say, I mean, obviously, historically, the aim of the Optilis before David's time and before Matt's time was really to grow quite quickly. And I think I've mentioned when talking to members before, the change of strategy we took on probably about 2 years ago, which was not to do that and really focus on a better run company, providing better services and greater efficiency. And, that was something that Matt and I always wanted. And, everything you said, Clive, about what David has achieved at Optilis since he's been there is true. And, I'm very grateful to him and his team for all the work they've done.
Thank you.
Got nice comments from both of you. How nice. I'd like to make one more. We on page 20, you talk about keeping customers and staff safe, and to not have lost anybody to any COVID infection over the last 18 months is really, really good. Your infection control within your organisation must be very, very good. So I think, you should take back congratulations to everybody.
I will with pleasure. Thank you.
Yeah. So on page 23, you talk about taking on at least 10 new and existing services. Are you able to give us a clue on what any of these might be?
I'll defer to Matt on that because the ultimate decision is the council's, not ours.
So, Clive, I wouldn't want to announce anything in a public meeting that hasn't been agreed yet, but most of those services are about the council has secured and renovated a number of properties across the borough for people with learning disabilities, so people can have good, safe homes in the borough. And this is about Optilis providing the support into those services. And we've got a range of those coming online over the next 6, 12 and 18 months. It's part of a kind of flagship program for me around good housing and good support for people with learning disability in the borough.
Okay, thanks very much. So I guess we will learn a little bit more about that at the budget scrutiny meetings.
Definitely. Definitely. It's in the MTFP and it was in last year as well. Part of that program was in last year, and this is about delivery. We're in sort of delivery mode now this year.
Okay, and then we're going to be looking at some income generation possibilities. Is that the same? Are we going to learn more about that when we go through the budget, or is there anything that you're able to say? I'm very keen on dementia cafes and trying to have some of those around the borough. I just wondered if those were figuring in your ideas.
So we commissioned. Sorry, Matt, go on.
No, go on, David.
We commissioned some research from the council's commercial advisor about where we might be able to do this successfully and provide additional jobs for people that we're training up through supported employment. So we looked at cafes. We also looked at charitable shops, we looked at horticulture, and we looked at the idea of a corporate cleaning company, which would actually tap into corporate social responsibility agendas for companies. And so we're working out plans around that. But one thing we're not going to do is move forward into anything that will be loss making. So anything we do will need full scrutiny from the council in terms of making sure that everyone is comfortable that the route we're going down is the right one. But I too think dementia cafes is a great idea.
Okay.
Could I just add to that? Is that okay? In terms of future services, I think we've got another slot when we're coming back to this committee to talk about those. So we'll keep you updated as we go, because obviously we want to be as transparent as possible. And then in terms of your dementia cafe kind of idea, Clive, there is a subgroup of the Wellbeing Board which is forming a dementia alliance across the borough to look at what are gaps and where we need to develop our services to people who suffer from dementia. So that's ongoing. So we'll get you sort of paged into that, I suppose, or plugged into that, Clive. I'll have a chat with David maybe my next catch up.
Okay, thank you very much. That's the end of my questions, but thank you very much, David. You've done a great job.
Thank you.
Thank you, Clive. Tahir.
Yeah, hello, David.
Hello.
Again, I just want to echo what Clive has said about the job that you're doing. Some of the questions I wanted to ask, elements of them have already been asked, really. But I will ask a couple of them and a little tangent to one. When you say you do a lot of services, so when you're putting, as an accountant, when you're putting your budget together at a point in time, and you're then identifying services that you're going to supply for the year, for the coming year, what criteria do you use to prioritize the service that you're going to provide? That's one thing. The second thing about saving approximately £1 million, which I'm not always sure, people always say, oh, well, we've saved money and we've saved this and we've saved that. I mean, that's really good. As long as you can maintain a level of service, and then that extra money is used maybe to provide extra service or extra resilience or extra training for your staff or whatever the case may be. Is that the case, or has that extra money disappeared into the ether? Thank you.
So on your first question, the overriding most important thing we look at is safety of the service. Not all of our services are regulated by the Care Quality Commission, but a lot of them are. And the one thing we are not prepared to do is compromise on any of that safety and any of the CQC requirements. I'm not prepared to be sitting here at the top of Optilis seeing services that are substandard or services that are slipping. I'm just not prepared to have that happen. And if that means I have to have difficult discussions with Matt and his team around how much the service is going to cost, I'll have those discussions, and I'm sure Matt will be very robust in return. But we share a completely common view on what we need to do for local residents, and we won't compromise on that. So we look at the specification of the service, we work out how we can deliver it, we think can we use some technology solutions, invest in new tools and so on that would help us to deliver a better service within the same cost envelope. It's that kind of thought process we go through, and then everything is rubber stamped by Matt's team, Matt's financial lead, to make sure that the council is comfortable with what we're doing and where we're going, and then that is scrutinised on a month-by-month basis through the year. So there's complete transparency, as I said earlier. In terms of the second question, and again, I might defer to Matt on this, but I mean, the discussions I've had with Matt are that this is not about taking money out of Optilis and losing it. We have very, very constructive discussions about, right, you've demonstrated your commitment to efficiency for council taxpayers, but what can we now do with some of those savings, depending on what the wider budgetary position is, to invest a bit more back in Optilis for different services. But Matt, I think it's probably your call to say something on that.
Yeah, definitely. I mean, the budget for adult social care grows year on year. Where we find efficiencies, it's about using that money then to strategically reinvest in services to try and get services that are more upstream, that get to people proactively, sometimes known as prevention services. So part of the efficiency generated in Optilis, we've been able to fund that peripatetic team to take new services, to do more things. Tomorrow night, we're going to be talking about additional investment into the voluntary sector to do prevention things. So it's all part of that plan. So it isn't a kind of savings and cuts. It's about that reinvesting in a strategic direction for the department within a very difficult funding envelope from central government and growing demand in adult social care. It's trying to balance all those things. But you know, we're making good inroads into that.
And I have to say, from Optilis's perspective, it doesn't feel like things are being pared to the bone. It's about us running a really tight business in a way that makes sure that we're delivering value for money for the people who fund us. But it's all, as Matt says, from our perspective, it's all about how can we deliver even better services. It's not about paring things to the bone.
Thank you. Thank you.
Okay, so can I ask, how has our relationship with the Royal Borough changed over recent years?
Do you want me to do that one, Matt? Or
Yeah, sure. Yeah, go, Charles.
I think, Alison, I would say the relationship has changed. As I said, when myself and Matt came into position, there was this very strong focus from the Royal Borough of wanting to grow Optala, and this predates David, I will say, but wanting to grow Optilis as make it this big provider which covered hundreds of councils and this kind of thing. And we kind of looked at this and thought, this is A, we don't know how this can be delivered. B, there was no person in David's position at the time. And C, how is any of it going to be kept under control? And really the prime focus should be, as I said, in, you know, a better company delivering better services, better value for money, and more focused on the end client. And as I said, David's been instrumental in delivering that. Now, I think the Royal Borough took a little while to see it from our point of view, but I think they've now come to realise basically that we can be partners and we can have the same aim and we can work together, and there just needs to be a little bit of flexibility in the arrangement. And, you know, David mentioned in his presentation how funds are ring-fenced. You know, Wokingham is effectively run in an independent way, and that RBWM is run in an independent way. So at the moment, the relationship is much better, and let's hope it stays that way.
Yes, certainly do. Thank you for your answer, Matt. I'm going to go to Adrian next, and then to Jenny.
Thank you, Alison. Thank you for a very positive report and a very encouraging information concerning Optalis. And again, echo what Clive and Tahira said. I wanted to just ask you one question about the ability to travel. I see this as very encouraging that you're striking up new partnerships with, I think it's South Western Railway,
yes,
Network Rail and Reading Buses.
Yes.
But one question, I was talking to the voluntary sector a couple of weeks ago, and they actually want to increase their services in terms of picking people up and dropping people off. They support already transport to the Royal Berks, etc. I just wondered if the voluntary sector would have any partnership role in this travel.
I would be very interested in that, because obviously public transport doesn't go everywhere, and so if people want to get from Wokingham to Bracknell, or they want to get, on the bus, then that's one thing. But I mean, in terms, if you want to get to the Royal Berks by bus, it's going to take you. I've tried it. The number 3 service seems to take about an hour and a half to get from centre of Wokingham to the Royal Berks. If there is a better way which provides a better set of outcomes for people, of course we're interested. So I would love to talk to those people about how we could actually work together.
I think they'll take an action to talk to Matt. We've got a meeting coming up soon. But yeah, thank you very much for that answer. One further question. I think at the start of your presentation, you mentioned increasing staff levels from, was it 700 to a much bigger number? Could you just clarify that?
Yes, so the projections we've got depend on all of the new services we're talking about actually coming to fruition. And as Matt mentioned, they're subject to council approval and so on. But if that were to happen and we were to take on the kind of services we're looking at, yes, we expect that we're going to, unless there's some miracle of automation in the care sector, which will reduce the need for people, we're expecting to need a staff headcount overall across both boroughs of around 1,200 to 1,400 in a couple of years' time.
Thank you very much. Thanks.
Okay, thank you for that, Adrian. Thank you, David. Jenny.
Thank you, David, for an excellent report. Make me pleased to see that. Sorry, can't you hear? I was good. There, can you hear me now? Yeah, okay. Thank you, David, for an excellent report. And I was very pleased to see that you're teaching people to do things for themselves, as evidenced by teaching people to travel by themselves. And you probably answered this question, really, but is there anything else you can tell me about how you see the future of Optalis?
So I think the future is in the process of being thought through. I mean, I don't just want to look at what best practice for care looks like across the UK. I want to look at what best practice looks like overseas as well. I want to see what technology solutions might bring, as long as the investment costs are reasonable, that could produce even better services for the people we're entrusted with. I don't want to rest on our laurels. I think one of the things that the pandemic, as I said earlier, the pandemic's taught us is that there's been a lot of things done in traditional ways within the care sector, but actually the pandemic has shaken that up and it's challenged us to think differently. And so Matt and I I think we're having quite a lot of discussions over the next few years about, where this might go and where it might take us. And part of that will actually be talking to our customers. It'll be talking to the council members. It'll be talking to a lot of people about what could we do differently and what might the outcomes of that be if we do it.
Thank you.
Right. So thank you very much, David, for joining us tonight. We've got another question for you from Nick Derman of Health Watch. This will be the last question because we've got quite a full agenda tonight. So we'll have Nick's question and then we'll be able to say goodbye to you. Thank you very much, Nick.
Just very quickly, one comment and one question. On the supported employment scheme, in our regular meetings with the CLASP Adult Learning Disability Group, there's a young lady there who's used that service and is in employment, and it's clear the positive effect it's had on her life. So
lovely.
Brilliant. And the other one, because I'm always interested in people's experiences, mainly. So it's really a question about how do you measure the quality of service from a customer perspective, and how often do you do that?
Yes, that's a great question. We have a lady called Jodie Reichelt who is specifically employed as a customer ambassador within Optalis, and her job is to make sure that we are talking all the time to customers about their feedback. I mean, actually, my recruitment was a really unusual one for me because I had 3 sets of interviews. The first one was with the council members from both sides. The second one was with Matt and his counterpart and various others. The third was at the Westmead Day Centre, where I was interviewed by customers, and the customers had a say in my appointment. And it's part of the commitment that we make in our strategy and our values, that we co-develop our services with the people we're here to serve. And I actually experienced that myself. It was a very strange environment to go into, where myself and the other people competing for the role were all in this group of people in the day centre being bombarded with questions, and it was fantastic to meet them. And I've never had anything like it in my career before. It's a new way of working as far as I'm concerned, and I love it.
Right. Anything more to add, Nick? Okay,
No,
thank you
it.
very
Thank
much,
you,
David. Right, if you'll stay with us, please, Matt and Charles, because we're now moving on to the next item on the agenda, which is the key performance indicators for Q1, the Adult Social Care and Health Department. Do you want to say if we have all read this? Is there anything you want to add to that, Matt or Charles?
Not really, I don't think. Should we move just straight to questions? And
yeah, very pleased to do that.
Yeah.
So kick off, I think we would congratulate you. Obviously, you've had a massive challenge in the last 18 months, which has continued through Q1. Unsurprisingly, you've seen that huge increase in demand. So well done to everybody for what you've achieved, all the officers, everybody in the care staff. It is hugely appreciated. And all the members here, I'm sure would join you in that. But obviously our job here is overviewing Scrutiny to add value to the work of the council by digging into the figures you've presented. We clearly seem to be doing better than most local authorities in the southeast. which is excellent. I wondered if you could explain the logic of the stretch targets. We are below 2 of them. So are these targets realistic? Are they achievable?
So I'm obviously going to answer yes to that, I think. The way we set targets for each of the indicators is to set a stretch target. My ambition, a lot like David has just talked about, my ambition for the department is for us to be a top performer. So deliberately, the targets are set as stretch targets. We do that in a number of ways. Some of that is based on where I want performance to go in the council, in the borough. And then we also look at benchmarking data where available, and we aim to be in the top quartile in the region, if not in the top 10%. And that's how we set those. Now, whether the issue about achievability, and maybe we'll get into some of the detail in a minute, has been affected by COVID. Demand is up, and also we've had to look at safety and infection controls and have our focus on some of those things. But I'm confident that all targets are achievable, but difficult to achieve. I don't mind seeing a red indicator if we've set a stretch target and we've got a clear direction to hit that indicator.
Good, thank you. Charles, did you want to add anything on that?
No, apart from just to second everything Matt said, it's always been our aim that we want performance to be, in the best 10-15% of authorities in the country on normal measures, and we're trying to challenge people to achieve that. And just to pick up what you said at the start, though, it has been an incredibly pressing period. I remember Matt and I normally meet every week for probably an hour and a half to go through things. We discuss things most days, one issue or another. And I remember there was a good 6 months of this where we were discussing nothing else but the C word, basically just endlessly. So, yes, there's work to do, basically, but I'm very pleased with where we are.
All right, we've got questions from members. Adrian had his hand up. Is anybody else want to ask a question? Norman? Okay, right, Adrian.
Actually, I'm very encouraged by the mixture of red, green and amber. I think it really shows that you're managing the whole department. I've seen hundreds of reports that are completely green, and I never trust any of those reports. It's good to have some stretch targets. I appreciate that. I appreciate the really what I can see as really top drawer management from both of you, and I really appreciate that from all our residents, all the residents that I represent. I don't really have a question other than, please carry on.
Thank you.
Thank you. Thank you.
Yeah, thank you very much for that, Adrian. Norman.
Thank you. I have a couple of questions. I'll take them one at a time. The first one was on the indicator AS4, the safeguarding timelines. And clearly it's very good news that the concerns are now being completed quickly and they're above target. Can you tell us how that's been achieved, and hopefully it's sustainable?
Yeah, I can. So if you look at the timeline there, when I started as director, that would have been about May 2019. Certainly that was an area of performance I was not happy with. We made some immediate decisions to put in a dedicated safeguarding team, the ASH, Adult Safeguarding Hub. That team was put in quick order and has put a new kind of safeguard responding kind of regime in. That's well embedded now, as you can see, and bearing fruits. And that team is pretty much well established now and fully resourced. So we will maintain that performance. It's one of the things I'm particularly proud of, that we've turned that around. I can't see in front of me now, but I think we started about 20% and we're well up into the high 80s and 90s now in terms of responding quickly to safeguarding concerns. And obviously getting the right people with the right skills, getting their eyes on safeguarding quickly just means vulnerable people are much safer in the borough.
Yeah, great. Thank you. Yes, I confirm the figures, 20% up to the 90% now, which is great news. Thank you. And the second question was around AS9, the permanent admissions to residential and nursing care homes per 100,000 population. This has turned down quite a bit in the last couple of years. I mean, it's good that people are not going into residential homes. Again, presuming that that means that more people are being looked after in their own homes. I just wonder if you can say a little bit more about that again, what the situation is and what the trend looks like being. Thank you.
Sure. Yeah. So, I mean, essentially, national policy, national good practice, and also the practice we have in the borough is about wherever possible to support people in their own homes. So this indicator is about us keeping an eye on the number of people going into institutional care, or residential and nursing care, and keeping an eye on those numbers. Now, COVID has had an impact there. So we certainly wouldn't, people who need that sort of care would get that care. We need to keep the eye on the numbers. So sometimes that fluctuates a bit, and that's because of the needs of the people, but it's just about us keeping a trend eye on that indicator to make sure that we're essentially doing all we can to keep people supported as independently as possible and in their own homes.
Okay, thanks. Yeah, I mean, there's quite a range. You go back to well, now it's down sort of 50, 60 or something, but it goes as high as 150 and a quarter. It's quite a variation. Is there?
It is.
Is there seasonality about it, or is it?
There is, yeah. I mean, most of the reason for that is COVID and periods where the hospital was maybe under intense pressure during the COVID period, and also through COVID there was a change in national policy around hospital discharge, which meant there were periods where there was some double counting, and we've evened those out. So that's why there's a bit of fluctuation in that particular indicator.
Okay, thank you very much.
It's settling down now. That's why the indicator looks better.
Great, thank you.
Okay, do we have any more questions? Okay, well, thank you very much, Matt. Thank you very much, Charles. Hope you'll stay with us, because we're now going to have a report from Health Watch, which is always very, very interesting, very informative, very well hearing. So welcome to Nick, and I believe Jim's with us as well.
Yeah, sorry, yes, I am. Yeah, I'm here as well.
Okay.
Yes,
be lovely to see you. Excellent. Thank you. So do you want to take us through your report, and then I'm sure members will have questions for you. We very much appreciate all the work that you're doing, and thank you for joining us this evening.
Yeah. So I don't propose to give a presentation. No time short, and I'm sure the members have read it. So it's open to questions, really.
Okay, members, who would like to begin? Okay, well, I'll kick off then. Have you seen a distinct improvement or a decrease in the health services that are being offered and received by our residents in the last quarter? Do things seem to be getting back on board following the pandemic, or health services are still struggling to a larger extent?
So I would say they're still struggling, and I'd refer to the Insight into Action report that just tries to give a summary not the full picture, otherwise it'd be 15 pages long, but a summary of the key things we're hearing. And the top two issues are access to dental care. Well, we know that's an issue. But increasingly over the last 3 months is access to GP services. And we've heard that through our help desk. I've heard it from local residents via email, telephone calls, and also heard it via the weekly Wokingham Borough Council and Voluntary and Community Sector weekly meeting through organisations like Age UK Berkshire, Link Visiting Scheme, Tuvida, which is the carers organisation, where some of their customers are having real trouble getting through to GP practices and getting appointments. And I've scribbled it down here because I've said it several times. It's an issue for everyone, and we're not here to bash GP practices. I mean, Charles will know because we had a meeting with Wokingham Medical Centre with members of Public Health. They're under severe pressure since we've unlocked more recently. It's clear people who had medical issues were putting things off for one reason or another. As Amit Sharma said at the PPG, or chair PPG meeting the other evening, you know, their calls are up 40%. So it is a big issue. I guess my concern is those of us who have the stamina or the doggedness or have family members who have that doggedness and determination of mind, or the digital capabilities will get through. My real concern, and those of people like Age UK Berkshire and Link Visiting Scheme, are the extremely vulnerable. You know, so if a GP's phone line has a maximum of 50 in the queue and you phone up and you're number 51, you might get a message that says, sorry, we can't take your call at the moment, please call back later. If they do manage to get in the queue and they don't have a hands-free phone and they're holding their phone to their ear for 30, 40 minutes, I would have a problem doing that. I mean, I could go on. So that's the real concern, the most vulnerable in Wokingham Borough. And, you know, there's stories from Age UK Berkshire when they're dealing with clients where their vulnerable clients have said, I've just given up, I'm not going to call anymore. So that's the real concern. So my questions would be around what short-term things can we put in place to relieve that? Because ultimately, those people, if they're very unwell, they're going to end up in hospital. They don't want that. The CCG don't want that. It's not very cost effective. So there needs to be a discussion around solutions. And I note that from a Wokingham paper, Charles has been speaking to the CCG about this. And I refer to the patient experience survey that was done late last year, which showed that a handful of Wokingham GP surgeries in terms of satisfaction are right at the bottom across West Berkshire, and a handful are right at the top. And I haven't forwarded it to you yet, Charles, but I will do. Was after that was presented to me by the CCG, I sent them emails saying exactly what you said. What do the CCG do with these results, and what can they learn from the best performing practices and help the least performing practices? But unfortunately, I didn't get a response.
If I can come in briefly, Chair, on that, because I can add a little bit to that discussion. You
yes,
happy
please do. Yes.
Yeah. So I think members will know. Picking up what Nicholas said, basically, and what I said at council last week, that, you know, I did write to James Kent, basically, who's the head of the CCG, really asking him, which is related to this, for what his improvement plans were at the 4 Wokingham surgeries in the bottom 10%. And I had a long response on Monday, which failed to answer any of the questions. Well, it failed to address the question specifically, but it did lists the following things, basically, which I'll read out now. I've actually written back to him since, but it said they are planning to commission additional GP practice appointments to increase capacity till the end of March 22. They're piloting how hospital emergency departments can book patients into GP appointments who attend with health problems, who can be supported with their surgery. They're ensuring patients can attend their GP practice to book appointments rather than phone. They're ensuring patients can receive face-to-face appointments. They're establishing a community pharmacy consultation service. They're carrying out an audit of GP practice phone messages to shorten the length of messages. There are various other things. Now, what it did not say, and what my letter back to them said, is how they're going to do this, when they're going to do this by, and when residents are going to see a real change on the ground. And the other thing, which I'd written to them first and asked them for, is improvement plans on the 4 specific surgeries involved, who are in the bottom 10%, and there was no response at all on that. So I've written back to them tonight, basically, before this meeting, and just said, I'll phrase it in a more polite way, basically, which is, I asked a specific question. Now, can I have a specific answer, please?
Yeah, and I think I'll just add to that, Charles. I do keep on coming back to those most vulnerable and what we put in place. There's one surgery in Wokingham, I think it's the new Wokingham Road surgery, that's put in a carers dedicated line. And my suggestion was to the CCG, well, couldn't you expand that? And the answer was, it's very they're standalone businesses. We can't ask them to do it. We can ask them, but we can't make them do it. But it's just, there must be some short-term solutions that we can put in place. Because I say, ultimately, these people, if they become very unwell, will then have to come under Wokingham Borough Council adult services even more than they are, or tragically, they'll end up in hospital. So that's a real concern.
I fully agree.
Right, members will note that we have on our November agenda to be seeking assurance from CCG on GP practice and provision and services offered within the borough. So I hope you'll be with us again at our next meeting, Jim and Nick, when we'll be raising these issues. The next person to ask a question is Clive, please.
Thank you, Alison. Jim, thank you very much for all of the excellent work that you're doing, contacting or being contacted by 1,581 people. That's just in 3 months. Excellent. The Facebook posts and all that sort of thing, which is very helpful to an awful lot of residents within the borough. I just want to ask a couple of questions on pages 51, 52, 53, 54, where you've got these lovely little charts. And who do you share these with? Because GP services, if we look at adequate and poor, it comes to 50%, well, 49%. And GPs probably think that they're doing a marvellous job. But the residents obviously don't think that. Mental health services, when you add those two together, comes to 57%. So whoever's providing those services, I don't know if that is from the council or where, then as far as the residents are concerned, not doing a good job. Adult social care, we just applauded what we're doing at Optimus, and yet we've got 52% of our residents think that adult social care service, and it might not all be Optimus, a lot of it might be outside of that, but they're saying that it's adequate or poor. So I just wondered who you shared these charts with.
So we would share any feedback we get with the relative service providers. I think you're referring to the What Matters Most report there. So we get intelligence from the public throughout the year, and we use it to set our priorities for the year ahead. And we decided this year just to run a survey, just as a sense check, you know, the feedback we're generally getting. At a point in time, what really matters to people in Wokingham now, what matters most. I think the key thing to say from that was the key issues that came out from that matched very similarly to the 5 priorities that came out from the Joint Health and Wellbeing Strategy. So that's good because it didn't throw up anything different. And I think, as Matt would say, you know, we've got those Joint Health and Wellbeing Strategy priorities, and you have those subgroups. So all of those key issues, the majority of those key issues that are highlighted there are priorities and initiatives that will be going forward throughout the next year. I would say around the GP access, which I haven't mentioned yet, but I will do now because it's the appropriate time to mention it. What we can't do is ignore it. So Health Watch are going to be running, starting next month, a GP access survey amongst Wokingham Borough Council residents. What we don't want to do, though, is just run a survey with the residents and use it as a stick to shake at local GP practices, because we're well aware of the pressure they're under. And this goes back again to the comments that Charles made in the Wokingham paper report that I saw. We want to work with them. We want to work collaboratively. That's what we've done in Wokingham, particularly during COVID. And, you know, I applaud everyone, you know, the voluntary community sector, Wokingham Borough Council, the collaboration has been incredible. That's what we want to do. So as part of that, we have a meeting with the CCG. We've been quite open with them what we want to do. We don't want it to just be a survey about Wokingham Borough residents' experience of GP access. We want to hear from the staff at GP practices about the issues they face, what solutions maybe can they see. And it's right that we ask them what their experiences are and understand those, because I think there's a communication piece here to local residents, because I'm not sure they really understand all of the pressures they're under. But if we're going to hear the experiences of GP practice staff, it's only right that they hear the experience of the patients who are trying to access their services.
Yeah, thanks. One of the things that really concerned me was on page 54, and it was maternity care. That 33% of people who responded to your survey thought that the maternity care was poor, and the other 67% were only happy with adequate. And surely having a baby must be one of the most important things in somebody's life.
Yes.
We're only scoring poor or adequate with our residents. So I think we need to have some fairly serious conversations with the hospital to find out why people are thinking that the service that they're providing is so bad.
Yes, I agree. And we did share that report with the CQC, and just recently, in the last couple of weeks, a CQC report came out showing that the quality of maternity services across the country were hugely varied, and there's going to be more work done on that.
Okay, thanks.
Can I just put in there, on the maternity side, I am aware, not necessarily in this borough, but others, and I suspect it's the same, is the amount of pressure on staff and the very low staffing levels in maternity units. And I think this is probably part of this is probably at root of a lot of these issues. As I say, I'm not aware of the Wokingham situation, but I'm aware of other boroughs where that is the case.
But if I may, there was one other thing I wanted to bring up, which isn't in those reports, but it's come to light very recently. So the members may want to consider asking BHFT to come in and talk about it. We've had several reports around the continence service provided by Berkshire Healthcare Foundation Trust. So a lot of these are carers, you know, who've had it really tough, as we all know, over the last year and a half, and starting to try and access services and maybe held off for whatever reason. We know some of that's been going on. Trying to access continent services, and there's an 8-week waiting list, and that's causing really big concern. So this has been reported by local residents, but also again by Age UK Berkshire, by dementia coordinators at Wokingham Borough Council, by the Link Visiting Scheme. And when I queried it, they listed several things. One was not having enough access to clinical rooms to do proper assessments, and various other things. I can forward those details on, but it might be something you want to consider.
Yes, indeed. Right, next question's from Michael, then I'm going to Adrian, Tahir and Jackie. Okay.
Yeah, thank you, Chairman. Yeah, thank you, Nicholas and Jim. It's a very, very informative report, a snapshot, as you were sort of referring to. Well, actually, Clive Jones has kind of referred to a little bit of this earlier on about the mental health of both adults and children, where it's viewed as poor. It's, you know, you can see it's 42% for adults and a whopping 75% for children. I'm quite surprised no one's actually mentioned this before, but that's the most striking one of all of it. I'm just really wondering about the ages of the children. Are these like younger children? Are they older children? What sort of ages are they? And how would you see Health Watch and or Wokingham Borough Council? How would they want to be involved with that to get that alarming figure down? We obviously want more green of good rather than just 12%, which is exceedingly appalling, I think.
In terms of the ages, we do ask the demographics, but of course, when people get to that bit of the survey, very few people want to answer it, or they don't answer it. In terms of what's happening, I think I alluded to it earlier on. It's a collaborative effort. It's one of the key priorities for Wokingham Borough Council Health and Wellbeing Board, as Charles will acknowledge. So there are initiatives underway. So I don't think it's necessary for Health Watch to go off and do a project necessary on this. We are in some of those subgroups, and that's right, you know, because we can then feed in what we're hearing from local residents rather than going off and doing something ourselves. I think that's the right way to go. And Charles may want to comment on it.
Yeah, I mean, I would just come in briefly on that to say, basically, there's a variety of things which contribute on mental health. First of all, you know, we're dealing with this when the pandemic was going on, basically, when all the net effects on people's mental health. Secondly, health historically has been supported by the NHS largely. Thirdly, members will be aware of the Human Mind service that the council set up basically for 18 months to support mental health more in borough for adults, which we're really excited and positive about. Now, in terms of mental health for children of school age, I'm talking slightly outside my portfolio here. And there are probably better people to talk about it than me, but I do know quite a lot of work is going on to try and support mental health in schools across the borough. But that's more probably a question for Graham Howe than myself.
Yeah, thank you for that. I mean, maybe, well, we obviously want to report back on this at some future stage. I mean, I appreciate it's outside your remit. Certainly adults isn't, and that's not exactly great neither, but I'm heartened to see the work's actually being done on it. But maybe at some future HOSC meeting, we should ask Councillor Howe to attend together with the the director as well, which would be absolutely great, because I think we need to sort of challenge them a bit on that if it doesn't improve. Thank you.
Could I ask Norman, as Chairman of Children's Services Overview and Scrutiny, if that's something that his committee would be looking at?
I don't think it's on our agenda at the moment, but it's something that we could bring up, certainly as it's come up through this.
Yeah, I know in the last year we did some joint work looking at mental health for children. So perhaps that's something we can discuss later in the evening. Thank you. Michael, did you want to add more to that, Nick?
It was me, Chair. Basically, all I was going to say was if the committee took the view it wanted to look at the progress of the Mind service and the difference it's made in 12 or 18 months, that, you know, it's not for me to tell the committee what to do, but I'm sure they'd be happy to go and talk to you.
Well, we do have mental health services post-COVID 2019 on the agenda for January. So we will be looking at that.
That might be a bit early to judge the effect of this new service, but it's obviously your call, Chair.
Yeah, we might be able to put it back to March. We can discuss that when we're looking at our forward programme.
Yeah, I mean, just to add that there were many initiatives. I was part of the Future in Mind group that's now morphed into a new group, the name of which I can't remember, forgive me. There's the first meeting coming up very shortly, but there were a lot of initiatives there around children's mental health.
So, Nick, could I just ask you a little bit more about the survey? You said that over 100 people did it, which is, but that was a self-selected audience, wasn't it? It was the people who chose to take part. It wasn't a cross-section of the residents in the borough.
It was an open survey that we put out.
Yeah, I mean, do you think people tend to take part in these when they're not happy with services rather than, you know, the people that were perfectly content with what they'd been provided with wouldn't have taken part in the survey?
Well, it's $1 million question. Let me give you this feedback. When people come and talk to us about services, not through a survey, either through our help desk or by emailing me and my colleague, I would say that 3/4 of the responses are negative and 1/4 of the responses are positive. So we do get positive responses, and we do absolutely ask for what's your experience, good or bad. It says on our literature, because where there's good service, why wouldn't you want to know about it and to highlight it so it can be replicated?
Yeah, and as you comment, I mean, you know, I mean, it says over 100. I mean, was it a lot more than 100 or just a bit more than 100? Just to be able to put into context.
About 126, because we held a couple of focus groups as well. But it was really just a sense check for us.
Yes, I mean, because it says 78 people commented on the positive experience, and you highlighted one of the health heroes as being Matt Pope and his team. Yeah. Okay. So back to the list. Adrian.
Yeah. Thank you, Alison. Firstly, I want to say a big thank you to Charles Margetts. I know he was going to ask those questions of the CCG and follow up on, I would say, the unsatisfactory and underperformance of some of the local GP practices. And yeah, I wish that he continues that putting that pressure on the CCGs. Secondly, I wanted to say again, we see another good quality Health Watch report, and I want to say thank you to the Health Watch team. And you can, I would say, clearly see a sort of forensic level of detail in some of the responses we get from Nick, who's clearly, you know, tapping into the community and what's really going on. In terms of questions, really for Nick, I heard that there has been a change of management at Woking Medical Centre within the last 12 months or so, I believe. Have you noticed any difference in the kind of feedback you're getting with regards to the Woking Medical Centre, or is it still quite negative?
It's hugely negative, unfortunately. And the real frustration is, and I'm talking about, it's getting late, but it's across the gambit of things. You know, it's the real frustration is I've been meeting regularly with the CQC every 6 weeks for the last 18 months. That wasn't something that happened regularly before COVID, but in the spirit of collaboration, these things have happened. and I've fed back to them numerous issues. Woking Medical Centre was rated as requires improvement. At the last inspection pre-COVID, they'd stopped having their physical inspections, so they were doing it in a different way via phone calls. I had a meeting with them just before they recently inspected them a few weeks ago, and we talked about all the issues that I'd raised around Woking Medical Centre, and Woking Medical Centre were rated as good. So that was a huge frustration. A frustration I know from the weekly volunteering community sector and Woking Borough Council meeting we have, you know, people like Age UK Berkshire who fed these things in, Link Visiting Scheme, about how we could present all these different issues. But, you know, at the end of the day, they rate them on their 5 categories, you know, and maybe the things that we brought up didn't fit nicely into those categories enough to continue to rate them requires improvement. But it's a huge issue, and it was no shock to me in that patient experience survey that they came bottom in most of those categories.
One of the encouraging things we heard today from the dentistry guy was that NHS England actually recognises, and this is the first time I've heard this, that there is going to be a significant rise in the population, therefore significant rises in requests for dentistry and GP services in this area, in this locality. So I think we've got something to follow up with, and I'm always keen for Health Watch to follow up on, your top priorities. And you mentioned dentistry and GP services. So keep on doing the good work, I would say. Thank you.
So, yeah, and I would just add again, that we're going to do our GP access survey and report because I think it's needed. And I guess the other worry is, and I think it was Clive who mentioned, forgive me if I'm wrong, there's going to be another 30,000 residents coming soon, and so what will that mean for GP provision?
Yeah, I was very disappointed. We had a meeting where the CCD were represented, and I asked them the question about WBC offered a site for a new GP practice as part of Montague Park, I think, and that was declined by the CCG. When Woking Medical Centre is totally overloaded with patients, which I just thought was ridiculous. So hopefully now that the dentistry guy was saying that they understand there's going to be a big rise in population, they will maybe get the picture that they actually need more GP surgeries and more dentists here.
Thank you for your question and your answer, Nick. I'm going to go to Tahir next.
Hello. Thank you for these pie charts. It's really very good and informative. I think most of what I was going to ask has been already asked and answers given. And my concerns, like other people, is the mental health, both for adults, children, and the on page 54, the maternity care, which is probably the worst pie chart here, actually. But my question is and these are very good and they're very informative. And I was really pleased to hear you say that what you're really looking for is collaborative working and helping other people, which I think is really, really good and the right way to approach this. But when you do a pie chart like this, and you've got obviously really bad results for adult or children mental health service or the maternity one, do you sort of say, well, we're going to isolate these 3 or 4 or 5 or whatever it is, and maybe do another survey to get into the root causes of these issues? Because you're in a good position to get that information in the first place to produce this pie chart, and therefore you're in a good position to take those really bad results, as it were, and say, let's dig into those a bit more to get why people think mental health for children or for adults or maternity care is so poor.
Yeah.
Thank you.
I think I'll go back to what I said earlier on about a collaborative approach, and those particularly around mental health, they are priorities with the Health and Wellbeing Board, and Health Watch have been invited to be members of the subgroups. And so, you know, as part of that project, and they're just getting going, but the way I would look at it, we're glad we've been invited to be part of those groups, and part of those actions going forward might be that Health Watch carries out another survey to try and dig down further. It might not be a Health Watch survey, it might be a Woking Borough Council survey. That's to be decided. I think the key thing is that we're included, and so we bring the voice of the local residents in whatever way it's decided that we do that as we move forward with those projects.
Okay, thank you.
Thank you. Jackie Rance.
Yes, mine is just a comment over the last year, and congratulations, because this signposting for people to go to different places, it worked very well. I had direct involvement, particularly with Link visiting scheme and helping people on the phone. I have 2 members of my family or young grandchildren who have ADHD and ASD. There wasn't so much help there, but and also the food banks. They all work pretty well. So I'd just like to say, you know, well done on those aspects.
I think we can certainly all join you in that, Jackie. The voluntary sector and everybody pulled together in the community has been exemplary. Do we have any more questions for Health Watch? No more tonight. I know we'll look forward to seeing you again at the next meeting. So thank you very much for all the work that you do and all of your volunteers. And hope you enjoy the rest of the evening. Thank you, Nick. Thank you, Jim.
Thank you.
Thank you.
All right, just to update members that we are not going to be having item 29 as the officer's not able to join us. So I suggest that we put the public toilet provision update back to January, because our next meeting in November is really packed. We can't possibly add anything onto that. Which brings us onto item 30, which is the forward programme. And if everybody's got that in front of them, it is on page 67. The next meeting, we're looking for an update on the Royal Berkshire Hospital operations, the redevelopment plans. Do we have it confirmed who will be joining us, Maddie?
I've sent a request to Steve McManus.
So we don't, yeah, we're still waiting to hear on that one. The other thing we're going to be looking at, Charles, you're still here, aren't you, is a further briefing on potential changes to service in Woking and by Optalis. Is it possible for us to defer that, Charles, or is that something that would be going to exec following scrutiny? Charles? Still got the people on Teams for this? Oh, okay. So the major item, I think, in November for members is the CCG returning. Since we saw them only last week at the extraordinary meeting, but to really see if we can dig into GP practice provision and the services being offered, because we heard from Health Watch, and we all know from our own residents that there are issues with that. Charles, I was just asking if the briefing on potential changes to services in our borough for Optalis, is that something we do need to look at in November before it goes to the executive?
I don't think so. Well, I mean, it's obviously your call, Chair, basically what you want to do. I don't think they'll be ready for November.
Right, okay, well, I think we'll probably have a lot of questions for the RBHF and the CCG about GPs. And you did suggest that looking at mental health services, it would be a bit early in January. We might need to move that to March.
Yes. I mean, the new service went live. Where are we today? Gosh, probably April, May. So to make sure there's some data to make it look meaningful, basically, or draw conclusions from.
Right. Okay. Well, I think that's helpful because, we often all have a lot of questions, and it's difficult when we've got too big an agenda to be able to do proper scrutiny of these things. So, members, would you be happy if in November we're looking at the Royal Berkshire Hospital Healthcare Foundation and the GP practice and provision, as well, of course, we've got the KPIs, the health consultation report and Health Watch. So if we move up TARLIS down to January and we look at mental health in March, that still gives us some opportunities to add more to January. Anybody got any comments on that? Adrian?
Yeah, no, that's fine with me. That's all good. I'm very, very disappointed with the maternity numbers, as some of the colleagues have said. This is a life and death situation. We nearly lost a child at birth in Royal Berks Hospital. So I would encourage the chair and Madeline to consider whether we can have a special session on maternity and try and drill into what's going on there, why are the results so bad, is it a staffing issue, is it what's going on? I don't know whether that would just be with Royal Berks or other institutions, but I would like to see a separate session on that. I understand we need a separate session on the redevelopment of Royal Berks generally, and I'm fine with that. But I'd like to separate out.
Okay, let's reach out and find out if we could do an item in January.
Yeah, that would be great.
On maternity provision, because midwives can be attached to our GP practices as well as directly through the Royal Berks. So looking at the whole service provided from, the complete 9 months and afterwards, I think that's an excellent suggestion. And I think all members would support having a look into that. It was quite shocking that, of the people surveyed, which wasn't a huge number in the context of residents in the borough, but it was rather shocking that nobody said it was good and adequate to less than okay. Adequate or poor was the result, wasn't it? The other suggestion that we had from Health Watch tonight was to look at the continence service. So perhaps we could find out when they would be able to present, look at it. We could fit that into January if we're moving March to mental health services, and perhaps we can invite all of the children's services members to that part of the agenda, Norman. We're looking at a whole spectrum of mental health. So if we put that into March without adding any extra items, we will be looking at the KPIs now each quarter. We've got one in November, one in January, and then again in March. Does that fit with the quarters? Yeah. And when we're looking at the KPIs, could I ask that if we've got any questions that are simply just some explanation, if we could email those into Madeline, and then Madeline can make sure that all of us get the answer back. Sorry, I'm very tired. Tahir.
I was just thinking about item 29. Where does that come in?
Sorry?
Agenda item 29, which you just missed today. When is that going to come back into the
Well, I was suggesting that we would look at it in January, because I think in November we've got a lot to look at. Not so much in January. We've all read the report. I had hoped we might perhaps invite some presentations beyond the officers, which gives us more scope to do that now. Perhaps somebody from, the Crohn's and Colitis Society or IBS, or I'm sure pregnant women are very interested in public toilets as well. Perhaps just to get some more input, because the report was a little bit what we're doing is fine, I felt. But not wanting to scrutinise it right now because they're not here, just to dig into it a bit more. I think we do have some, Clive, there were some members that we perhaps were specifically going to invite for their input on this as well. Yeah. Okay, has anyone got any other items that they think we should be looking at in this council year? No? Oh, I can see Nick's got his hand up on Teams.
Thank you. Yeah, no, just a quick one around the continence service. Were you saying perhaps January?
Yes.
Yeah, I think that might work well, because one of the comments from the service manager, while listing some of the issues, said they're putting a rapid recovery plan in place. So it might be good to hear in January whether that 8-week wait has improved at all with this rapid recovery plan or not. Yeah, and to be frank, it sort of fits in quite well with the public toilet provision, doesn't it? The service users of both. So, Jim, if you could do any reaching out to the public through Health Watch about their opinion of public toilet provision across the borough, that would be very, very informative. I think he's left,
Sorry,
but yes,
it's
we'll
not
do
him.
that.
I apologise, it's Nick.
Yes, we'll do that.
That would be great. Thank you very much. Right, if nobody's got anything to add, I think we can close the meeting. Wish you all a good evening. Thank you so much, because you've worked really hard in the last fortnight. You had adult social care training last week, as well as the extraordinary meeting and the scheduled meeting tonight. So thank you very much. It's very much appreciated. Oh, and thank you very much to Lucianne and to Madeline.
Yeah, thank you very much, Chair. Thank you very much, Madeline.